Bobbie, welcome to our first show, Vitality. I'm so grateful that you're here as our first guest.
Thank you, Nina. Thank you so much for having me. Really appreciate, and it's such a privilege, to be honest.
Yeah. Well, I remember when we first met, you interviewed me for the Move Health and Wellness position as a sports performance coach.
Yes, correct.
And what I loved about you is just your energy and the fact that you just are so excited and passionate about helping people live a life of vitality and all about prevention.
Yeah.
So share with everyone, where does that passion come from for you? When did that start for you?
Oh gosh, I think when I think of people living the type of life that is either purposeful or, as you mentioned, having vitality, I feel like it started with me right after I had my first kid. I had gone through a lot of fertility struggles with my first kid, and then going through a second round with my now twins, 3 years old, and having to experience what it was like going through the IVF process, not really having control of what your body's doing, because having managed patients myself, it's very easy to see, for those people who didn't anticipate getting pregnant very quickly. For some, it's very easy, and for me, it wasn't quite that journey. I wanted this so much, but then once I finally got pregnant, had my children, it was the aftermath where I started to feel like I don't feel like myself anymore. I am exhausted. I feel like I can't quite focus. I feel like I'm juggling 20 different things. I remember when I used to feel good. I remember what it felt like to be myself. And in that moment, I didn't feel like myself. But I couldn't quantify what being myself was like. I didn't know how to verbalize or even come outwardly to say, I used to have energy and now I don't. And I used to sleep 6 to 8 hours and think that this was sufficient, and now it is broken, and I'm so tired I can't fall asleep, but even when I am asleep, I don't feel rested. And it's hard to actually quantify that, and where people understand what I'm trying to get at, to say, I just don't feel like myself.
Yeah. I think that what you just said, though, is resonating with so many women after they have children, and they're tired. First of all, you're just tired.
You're exhausted.
And you're not getting sleep.
No.
You're just not. And I didn't know also that you had gone through fertility issues. And I think some people do. I did also.
Oh, did you?
And
I didn't know that.
Yeah. And so that in itself can be stressful and emotionally draining for you as a couple. So you had to go through that. And how did you get through that period?
I will say I am lucky to have had a really good support system here. My sister lives close. My mother lives half the time with me, half with my sister. And when I say close, she's 4 miles away from me. And it's been the three of us since my father passed away when I was 19. So it's having the support system here really made it a lot easier than most other people have to go through. What I also am very thankful for was having not just my family, my friends, but also having a job and a career and a support system there where they helped me make it through these stages. Having to, the IVF process, you're running to get blood work, you're running to get ultrasounds, you are living by this timing that you have, again, no control over. And and then you're being injected with hormones, and it takes a mental toll, emotional toll. I don't think I could have done it if I didn't have all these key pieces of my life to be so profoundly insular to me.
One of the things you said a few times is, I had the support system at home. I had the support system at work. And that's one piece, that community, that connection to help with energy and vitality. So you had that going in, and then you talk about, you recognize after you had your kids, you're having a moment, and you're saying to yourself, where's my energy?
It was energy. It was mood. It was even just looking in the mirror and thinking is that really me? Or like, how did I get here? And then having to balance being the best version of myself to be good for my kids and good for my husband and good for my mother, who's also aging, and being good for my job. And I think this is a stage that women go through. Sometimes it happens earlier, sometimes it happens later, but being in this very unique position where I'm caring for my mother, I'm caring for young kids, I'm also trying to balance my career, and I'm also trying to navigate this brand new landscape of being a mom.
Yeah.
It was a trial.
Well, you said a word that probably people are like, what is balance? You said you're having to balance all of it. And you also had a job. You had two jobs. You had raising your kids.
Yes.
That's one job. I'm like, that's one.
I feel like that's two full-time jobs sometimes,
You
right?
have three. So that was like two jobs.
Yes.
And then you had your mom. That's a second job, caretaking that.
Correct.
And then you had your work.
Yes.
And so balance is so different for everybody. How did you get balance, or what felt like balance for you when you say that word?
I struggle with the word balance, to be honest, because I feel like there is you're wanting everything to be even.
Yeah.
And I don't think I ever had a moment where everything was even. I was equally a good mom, as equally as I was a good wife, as equally as I was a good daughter, and, in my profession, physician, director. I don't think I ever had that balance. What I was able to work towards was recognizing which priority I was going to take first that day or that week.
Okay.
And so it was a blend. I think of it more of like work-life blend. I never was able to find where I could say, oh yeah, I'm going to give 30% here, 30% here, 30% here.
Oh, perfect.
It was, I'm going to give 60% here.
Yeah.
And it's probably going to be this way for the next 4 or 5 days. But then I'm going to pivot and I'm going to give 80% here.
You were intentional about that.
I was intentional about it.
And you set realistic expectations in these areas of your life. It sounds like what you did.
Well, it took a while to get there. I think we as women naturally hold ourselves to a much higher standard than we would for, say, our friend who was going through something very similar.
Oh, you're saying personally.
Personally.
Yes, I agree with that.
Personally.
Yeah.
So I would look to myself like, I'm failing at everything. And I'm sure my friends and my family could hear me saying those things, that I'm failing at all of these things. But really it was, if I looked at what that priority was and I focused on being good at that priority for that day or for however long I was going to make it that priority, that being able to reframe what success looked like has been pivotal for me.
And that gave you energy.
That gave me energy.
So setting realistic goals
Correct.
In your life. I think, so you've talked about support.
Yes.
Giving you energy.
Yes.
Now I've just talked about setting realistic goals for yourself.
Yes.
Gave you energy.
I mean, I mentioned support when saying family and friends and career. There's also the support of nanny care, childcare. I'm privileged enough to have these people, multiple hands to help. I say it takes a village, not to raise my kids, but actually to help me. It takes a village to help me be the best version of myself. And I'm not ashamed to admit that. I think there's a stigma with women that they have to do it all and they have to do it all without help. And I'm here to push back against all of that.
No, that's a lot. It's exhausting.
It is
like I
exhausting.
said, that's like 3 jobs you had. And
Yes.
so it's good when you can delegate and get that support that way.
And recognizing that it's not a problem to delegate.
And that it's okay.
It is
So
absolutely
you had some good
okay.
self-talk going on as well.
A lot of self-talk, a lot of negative talk, I think, first off,
That's
right?
what it sounds like.
It started off being like, gosh, why can't you handle this, Bobbie? Why can't you do all these things that you see all the other Instagram and TikTok moms do?
And on Facebook, everyone
On
looks
Facebook,
happy.
Everyone is
Look
happy.
how pretty their kids
and
are.
They're
They're all
fulfilled.
perfect.
Yes, and they're fulfilled in doing all of that. And I'm thinking, that is so not me.
Yeah.
But in order for me to be the best version of myself when I'm with my kids, I'm going to need some help and support. And these are the areas that I seek it in.
And so, okay, so now you are having a good, healthy balance.
Yeah.
And when do you get back into investing more energy into what you do now, and that's helping people live that life of vitality? When did that kind of transition where you could put more energy there?
I actually think it started off with even my desire to do medicine, to be honest. My mom had it in her mind that I was going to be a physician. She probably saw it in me long before I did. And I pushed back on it because I really valued the human connection. I wanted to be able to be in a situation where I had the ability to impact somebody, one-on-one like this. And I hadn't seen medicine from that lens. I was surrounded by physicians in my family, but they were all hospital-based physicians, seeing people at their sickest. And I guess didn't truly understand the impact you can have in a longitudinal clinical and medical relationship with your primary care provider. And so shifting into family medicine, when I initially started off wanting to do OBGYN and deliver babies and be surgical, I really gave it a lot of thought and self-reflection on what meant the most to me in being fulfilled in my career. And it was having this longitudinal relationship. So now fast forward to, you're seeing someone as a child, you're seeing them as they grow older, you're seeing them before they get married and have kids, and now you're seeing them in every single stage with various life transitions and physical changes and mental and emotional changes, and being able to walk them through and usher them through and support them was very fulfilling. The problem that I was hoping to solve as being part of the move health and wellness is that I think when we are in a place where healthcare, or at least how we understand it in the insurance world, is wanting to prevent specific diseases. You have your colonoscopies, you have your breast cancer screen, you do all those things. They're all absolutely important. But how do you help the individual who maybe doesn't have any medical problems right now, but they may be struggling in, as I described myself, they just don't feel like themselves.
Right. They're off. They don't feel energetic. They don't feel...
And all the things that I would want, that I had told myself, that my doctors had told me, that I researched on my own, they were all the things that if I were to fast forward 20 years, would also set these individuals on the right path to prevent the diseases I want to prevent anyway.
Yes.
How do we pair an individual with what they are seeking in that moment to feel more like themselves, or to be the best version of themselves, with my goal of getting them to have more health to their years? And they're the same.
Yeah.
And so that having gone through it myself, I think, and then pushing me into, well, how do we take this now into the hands of each individual person by allowing them to have unfettered time with me, and to not have to be bound by the confines that health insurance currently puts us in, which is you only have 15 minutes with your primary care doctor. And so that helped me, I would say, cultivate and curate what MOVE stands for today, which is really just focusing on how do we add health to your years? How do we have you live and be fulfilled?
A healthier version of you without having to see you all the time.
Absolutely.
And as you reflect, when you look at women in their 20s, or men and women in their 20s, 30s, and 40s, and 50s, what is like the three main things that if they consistently did would definitely put them on a healthier path than
that is actually
the average population?
I would say that is a very good question. Now that I have gone through my own health journey, I can say honestly, there are three things that I probably give more emphasis now that I didn't give to before. One, I heard this phrase before, and I can't remember who said it, but now I've coined it into my own mottos that I live by. But muscle is the currency of life.
Yes, muscle, right?
And so when I think of muscle, I think of strength training. And I remember way back when you would always hear, well, don't lift too many heavy weights because then you'll get really bulky.
Yes, I heard
and
that as
you'll
well.
build that muscle. And women aren't built that way. And so now learning osteopenia, sarcopenia, and all these medical conditions that if we had enough muscle built, we could prevent. Osteoporosis being one of them. That's
really big that you said that, though. You could prevent it by muscle.
Prevent it.
Yeah.
And so now doing muscle strengthening, resistance training, that is something that I give a lot of emphasis to now, both for myself and for my patients. So I'd say that's number one.
For people listening, when you say that, though, is it how long? Is it 10 minutes a day? Is it an hour, 3 times a week? How often would you incorporate muscle, training?
Good question. It depends on where they're at, because I don't want to say, do 45 minutes, do 60 minutes a week.
They're on this, right. They're just starting out. They're getting motivated by hearing you right now.
They're just starting out. If you are just starting out, then my recommendation would be to start off with just your own body weight.
Okay.
Don't get resistance bands. Don't get the weights yet. Just start off doing your own body weight. And by own body weight, start off with doing basic stretches on the floor. Start off, if you can't get on the floor, you can start to push against your own body weight against a wall. Starting off incrementally, slow, and I'm sure as a coach you understand, like achievable goals.
Yeah.
And focusing on what are you currently doing and how do you do it smarter, not harder.
Right.
I just had a patient we were talking about because she doesn't do resistance training or weight training right now in her weight loss journey, but she is diligent about walking her dog.
Okay.
And she walks her dog for 25 minutes a day. And I talked about, have you thought about a weighted vest while you're walking your dog?
I love that. Yeah.
Instead of
Rucking.
Instead of setting aside the time to do the weight resistance training, you're already doing this. You're already doing something that's good for your health. Number 2 for me would be actually getting cardiovascular fitness or cardiovascular activity.
Right. That's a great idea.
So she incorporated it, and she's like, I can't believe how difficult that was. And she goes, but I'm now up to 8 minutes just on the weighted vest alone, and I do this twice a day, and now I'm working up to 20 minutes in one go, and it is amazing to see that progress.
Yeah, and I love that. Just something small that she can do.
Small.
She's walking the dog, and now let me just put this weighted vest on.
Put the weighted vest
There's
on.
10 pounds, there's 20 pounds. I have both.
Correct.
And it's something easy to do, and it adds a little, gives you that little extra edge you need.
Yes.
So that's great. So strength training, and so start off with achievable goals.
Yes, achievable goals.
Okay.
And so for the person who has never done it before, I'd ask for 30 minutes divided up over the week.
Okay.
And how that looks, if it's 5 minutes a day, if it's 10 minutes 3 times a week, whatever is achievable for them. But I start off with 30 minutes.
Okay.
Working your way up.
All right. And then that was number 1. There's a couple more that you would suggest to people to incorporate into their life today. What is the second one?
Sleep.
Yeah.
The impact that sleep has, not just on mood, energy, focus. We are seeing now more than ever, we are seeing how it's impacting the probability of diseases later on in life. So you're looking at shortening your lifespan by 10 years if you have less than 7 hours of sleep per night. On average, that's substantial. You are seeing the impact that it has on behavioral health and mental health, depression, anxiety, the isolation. Lack of sleep can heighten our inability to focus properly, to achieve tasks, to be productive in our life. Not to mention the impact that it has on things like obesity, cardiovascular disease risk. It's profound. So go ahead.
Oh, no, you said obesity. Tell me how lack of sleep leads to more to obesity. I didn't know that.
Yeah, so lack of sleep actually increases your level of cortisol. Cortisol is one of the hormones that increase weight retention.
Yeah, weight retention. Okay.
And so when we look at how I would not give credence to this because I used to be in medical school, pulling all-nighters, trying to study. You drink enough caffeine, you can get by. It was just sort of the methodology we all adopted. And now more than ever, I'm seeing the impact of how sleep helps with, hormone regulation, metabolic function, and just even being more, like you said, intentional and productive in your day-to-day requires the energy that you need to have. If you don't have enough sleep, you're not able to achieve that.
No, and sleep, everyone's probably listening going, okay, yeah, I would love to get sleep. I just can't. I wake up in the middle of the night. I'm trying to get to sleep. I go to bed on time. What have you found to be really helpful to get good sleep?
Oh, good question. I don't know if my sleep is actually perfect now, but I will say that I'm getting a lot more than I used to. And I always tell patients, focus on what you may not be someone who can get a full 9 hours, and that's okay. Everybody is absolutely different. What the studies show is 7 to 9. For me, and what I recommend is avoidance of caffeine after 4 p.m. I think in today's world, having, a soda, caffeinated drink later on in the day is just, it's natural and it's part of our culture to go for coffee in the afternoon or have tea in the evening, really avoiding caffeine after 4 p.m. But it's a very simple thing, but having a bedtime routine. I always draw the correlation of when you put a baby in a crib, you want them to roll over and go to sleep. It's because you're training your body to recognize that the crib is for sleep. Similarly, our bodies have to recognize the same thing. So the bed should be for sleep and sex is what I tell patients. Sleep and sex. Don't be scrolling on your phone. Don't be watching TV. Don't be, reading a book. Try to do that outside of the bed. You will actually train your body to recognize that the bed is for sleep and for sex, and that's it.
Yeah, I like that. And I just know a lot of people have their iPhone next to their bed.
Absolutely.
For their alarm. And so what do you tell your clients that say, well, I use it for my alarm?
Yeah.
And I do sometimes pick it up. Like, is there anything they can do that you have noticed that's been helpful? I have some thoughts, but I'm curious what you've told clients or patients.
Yep. Good question. There are alternatives for alarms. If that is the only reason why they're keeping it next to them, there are alternatives for the alarm. There are alternatives to the phone alarm. I use Alexa, and I have a regular base alarm clock that I use, but I also use my phone for my alarm. Don't put it next to you. Put it on the chair.
Right.
In the corner of the room
where you can't reach
where
it.
You can't. It is, and I always tell patients, if you can't fall asleep within 15 to 20 minutes, get out of the bed and go sit.
Yeah.
So if you're struggling with falling asleep, sleep initiation is something that, especially in perimenopause, women struggle with because their mind is constantly racing. I tell them, if you can't fall asleep within the first 10 to 15 minutes, get up out of bed and go sit. Go sit if you want to watch TV, if you just want to sit there in silence, if you still want to sit there in the dark and try to get your mind to calm down. But until you start to feel drowsy, don't get back into bed.
Right.
It's about training your body, again, to recognize what the bed is for.
The bed is for sleep. Yeah.
And so if your phone is an alarm, just put it on the other side of the room.
When you say that, did you read the Atomic Habits? He talks about how, if it's right there, it's going to be easier and it's accessible. You'll do it, which is a good thing if you want to drink more water, have the water next to you. But if you don't like the phone, keep it far away. So if you want to reach for it at night,
you're not tempted to.
You're not tempted to. So I like
Correct.
that. Okay, so sleep. Third one.
We said sleep. I said
you said weight training, sleep, and
I don't know if this is an actual health thing. Maybe it's more of a personal mindset. It is. I read something, and I don't remember who it was from, but I read something that said it is hard to recognize progress when you're always raising the bar. And so, the third thing that I would say is to take time for self-reflection.
Yeah, it's really good, actually.
And it is hard to do that when you're in the hustle and bustle of things. But if you take a moment to recognize where you started and where you're at, and sometimes that can also put you on the right path for what you want to achieve. But even just taking 10 to 15 minutes, some people like to journal, some people just like to think and meditate, but taking that time for self-reflection so you can see the moment that you're in right now, where you started and where you want to go. I think that has helped me more than I gave credence to when I started on this health journey to see, so periodically my way of self-reflection is looking through old photos and looking through old notes that I've created. And I don't necessarily journal, but I write my thoughts down in notebooks upon notebooks upon notebooks. Or I put them in iPhone notes. And just scrolling through things from 2 to 3 years ago gives me pause to see where I started to where I am now.
Yeah, I like that
and it's empowering.
Yeah, that you self-reflect from the past. Like you keep little notes. Did I achieve those?
Yes.
Where am I at today?
Correct.
And I do think that self-reflection is really important for living a life of longevity, because you don't keep on going and going, and the next one you know, you're burned out.
Correct.
And those people that pause when I'm feeling anxious and stressed, I'm pausing what's going on.
Yes.
Where am I at? It's helping you maybe kind of reset and set some more achievable goals or the realistic goals in your life.
Yes.
And so you've noticed that is a big part of healthy living for you.
It has been, yes. I think when you always hear life is not a journey, it's not the destination. It's not about the destination, it's about the journey, right?
Yeah.
For me, my journey has always been to always think about, well, I'm just working towards this endpoint. It'll get better at this end. Prime example, I always tell people, oh, you know what? My February and March are terrible, but my April is going to get lighter. If I'm always working towards a future date and not living in the moment, it makes you spin your wheels. You feel like you're going to run out of steam. And I think I was at that point 3 years ago, running out of steam and I now find myself in a position of, I am going to take that extra minute. I am going to finish an hour early. I am going to maybe spend a little bit more time doing this activity because I don't want to wait until April or August or whatever I think it's going to be. I'm going to do it now.
I'm enjoying the moment right now.
Enjoying the moment.
I'm enjoying life today.
Yes.
Yeah, I love that. And I do want to ask you about exercise because to me that's, I only gave you 3 things to name. And so you're like, okay, just 3.
Yes.
But 3 that you found that would be really helpful for people starting their 20s, 30s, 40s, 50s. Let's talk about exercise because I do think that plays a vital role in general. What have you found as far as evidence-based that it's been really beneficial for people today?
When we talk about physical activity, we want to have, I know there's a lot of data around the number of minutes that you should do, the type of physical activity, and how often. I again come back to, I want people to work smarter, not harder. And so I always try to find and recommend physical activity that speaks to that individual. So for me, I cannot run a marathon. I know. I think you're a marathon runner. Am I right?
I'm a half marathon runner. I did 1 marathon and 1 and done. I do half.
I envy you because I am not a runner ever, but I love to dance.
Oh, okay.
So Zumba was my thing.
That sounds fun. Yeah.
But I know that's not for everybody, but that may be the thing that keeps you physically active. I told you about the patient, it was walking her dog. Yeah. There is going to be something that sparks your interest. I want that to be the thing you focus on. So for physical activity, minimum of 90 minutes per week, broken up.
20 minutes 3 times.
It could even be taking 2 10 minutes, fast walks, fast breaks is what I call them.
You said how many minutes a week?
90 minutes.
90 minutes, okay.
Ideally, 120 is what they recommend for moderate cardiovascular physical activity per week in order to reduce your risk of cardiovascular disease is 120 minutes. But I start off saying, if you can hit 90, you are setting yourself up for success.
Yeah, I like that.
You're already pushing your risk way down. Getting up to 120 is what the studies have shown, and that's where the evidence is. I want people to get there, but if you can get to 90, like you said, if you're doing 10 minutes even once a day, you're at 50 during the work week. Bump it up to 15.
When your clients, when you tell them exercise, they're like, okay, I'm going to do it. And they see you and they're like, okay, yeah, Dr. Kumar, I'm going to do this. And then they come back and they say, I tried, but I didn't this week. I'm sure you get a few clients. Totally. What do you think has been helpful to get them motivated to get out there and start walking and exercising?
I have an app that I use for myself called the 7-minute workout.
Oh, did you hear that? 7 minute.
7 minute. I probably shouldn't. I don't know who exactly makes it. I'm not a sponsor by any means, but it is the thing that helped me feel like I was achieving something.
That's great. I love the 7 minute.
The 7 minute. And it is a timed workout. They give you guided instructions on the physical activities to do. It could be beginner. It could be even for those individuals who don't even want to get out of bed. There's actually a 7-minute bed workout that you're just doing it in bed.
Oh, wow.
Leg lifts, stretches, arm circles in bed. So my point is there is no excuse at that point, but I get them started on that because that's how I got started.
The 7 minute out. Okay. It's called
the 7 minute. It's 7-minute workout. You can do legs, you can do arms. It's on the app store. You can download it, but just starting off, and they have it even as low as 4 minutes. But if you can find 7 minutes in your day, you can do this.
I think we can. I think about social media today, and people are on. I think they're on social media 7 minutes.
A lot longer than that we all anticipate.
I think we can do 7 minutes. Okay, so for you today, as you're moving forward, I know that you have got a lot of things you're doing. Tell people about a couple of things in addition to the HelloFam app that people can get to that really helps you live a life of longevity.
Yep. Yeah. So HelloFam really focuses on bringing all the different resources that help people live healthier for longer. So that means really focusing on sleep, social connection, your mental health, your physical activity, nutrition, and things. These are achievable, self-driven goals that you can achieve to live a healthier life. Move Health and Wellness, I'm also a physician founder for, helps with taking not just the evidence behind what we understand to be traditional conventional medicine, but also looking at what are the other integrative aspects to health. So how do we leverage the power of, say, peptide therapy? How are we leveraging the power of cryotherapy and cold plunges and infrared sauna? It's interesting, 20 years ago, people would go into an infrared sauna or a sauna, and they would always think that sauna is just, it helps you feel good. But now we have data about how infrared sauna can improve your risk for cardiovascular disease. It can also increase your heart rate so much so that you're doing almost like your body is performing cardiovascular fitness in the time that you're there. So now cardiologists are putting infrared saunas into their offices because of its health benefits. But it's not part of the traditional algorithm right now. So we're pulling from multiple different modalities to get people to live healthier for longer.
And it's all based on research.
All research.
So all the things you have at Move Health and Wellness is all based on research.
Correct.
And it's about, you've talked about longevity, but it's, we can live a long life, but we want to live a long, healthy life.
Correct.
And have that energy. And I want to go back to the HelloFam app because I was looking at it. Yeah. They can go to it and do an assessment to see where their health is.
Correct.
Because some people think they're healthy, but are you? And they ask you questions on the HelloFam app and give you an idea.
Yep.
So I wanted to share that as well. Okay. If people want to learn more about you and just ask you questions or visit with you on how they can get healthier, can you share a little bit about how they can contact you?
Yeah, absolutely. So the flagship for Move Health and Wellness is in Frisco. We opened up a second location in Farmers Branch, and that is inside of Extreme Studio Performance, which is a gym.
That's right. I will be more often.
Yes. Yeah. And we now have 4 additional locations throughout the country. I serve in 20 different states, both virtual and in person. Is really only in Frisco, and Farmers Branch, but I serve multiple different states across the country. So weight loss, hormone management, gut health management. I even do primary care and consultative services as well. But they can reach out through move.health. I can also follow me on Instagram, Dr Bobbie K. Bobbie. Right? And I think, as in my director role, a lot of the emphasis in my job is being able to look at what technology and healthcare startups are doing right now and how that, again, allows us to improve either the patient experience, the provider experience, meaning myself, so that I can give the best to my patients in the form of technology, services, equipment, or devices. And then lastly, be able to improve that relationship between the patient and the provider. And so my role in Inflect is really just looking at all these different portfolio companies that we've invested in and how we can use that to build healthier, stronger individuals and communities.
That's a lot. You do a lot, and you have 3 children, and I just love your heart and passion because that's what's driving you and giving you this energy because you love what you do.
Yeah, I do.
So thank you for being here and just sharing your heart and hopefully encouraging everyone out there to exercise more, be more active, do some weight training, get good sleep, all those things, or reach out to you if they need some more support.
Yeah, absolutely.
Yeah. So thank you.
Thank you for having me, Nina. Thank you so much.
Great.